Okay, welcome, Heidi. How you doing today?
I'm doing well. Thank you for having me on.
My pleasure. And I know you're like in between clients right now, so thanks for taking the time here. And yeah, let's just get right to it. Tell us a little bit about myofunctional therapy and first how you came to discover it and get into it and become an expert in it.
Well, so I've been doing myofunctional, it's actually called the orofacial myofunctional therapy. And I got into it in 2006. Basically, another hygienist who was going through the process of myofunctional therapy got me involved in it. Um, and I have to say, I was very skeptical. But I took the course. And then as I started to see the results and the changes in the faces, and not just the faces, but the changes in the whole posture and body, I really started to get into it. And I think as a hygienist, I always, I would get patients, and when I was in college, actually, we were told about what we call OMDs, which are oral facial myofunctional disorders.
Hmm.
And those are anything from tongue thrust to tongue tie, just a lot of different disorders. And I got my first tongue thrust patient, and I was so excited. And I was like, okay, so now what do I do? And the disappointment came when the doctor told me to just send him either to the orthodontist or to a speech pathologist. And I was like, oh, well, that's no fun. But for many years, that always kind of lingered in the back of my mind. And then when I had kids, and I'm looking at all these kids with speech problems, and I'm like, but they're going to speech. So basically, what's going on? So when this hygienist told me about myofunctional therapy, for me, it was a game changer, although I was still skeptical at the time. And I just had the opportunity to meet. My teacher was Joy Moeller and Leisha Paskey and Barbara Green. And I really learned a lot. And Joy and I, actually, she became my mentor. I would go to her office once a week. And then when she closed her office, she was using my office, and I finished up her patients. And that's basically how I got started. So it has really grown from there.
Wow, that's amazing. And we haven't even really explained what myofunctional therapy is, but that's, I'm glad you started with changing people's not just face and posture, which I don't think people believe is possible. But let's backtrack. And so what is myofunctional
So,
therapy?
so myofunctional therapy is it's an exercise program, which is actually unique to each person. Depending on, as we spoke about, their myofunctional disorders. And that could be anything from having a TMJ problem, not breathing through their nose, having their lips open, their mouth open, breathing through their mouth all the time, a low tongue posture where their tongue just never gets up into their palate, which will also lead to a high narrow palate, which is also going to show itself in chewing and swallowing. So they're not chewing and swallowing properly, which can all lead to a whole bunch of other problems, being digestive, hiccups, sinus, dull sinus area, and actually poor facial development.
Okay, wow, you just said a lot there. But let's start with one thing. like, why is it important to breathe through the nose? And try to keep this, try to keep it like understandable, because you know so much.
So
So why
breathing
is it
through the
important to breathe?
nose.
Yeah, people, many people know this. They hear it, that we're breathing through the mouth when we sleep, and we know it's important. But I know you know exactly why it's important.
So when you breathe through the nose, and I've had just changes on facial development by changing the way people breathe through their nose as opposed to their mouth. And when you breathe in our body, we have carbon dioxide. And when you breathe through your nose, and your mouth is closed, then you're actually getting nitric oxide. The nitric oxide, when you breathe in, is helping to open up the sinuses. And when you breathe in and out through your nose, you can't breathe in through your nose and out through your mouth. So when you breathe in through your nose, then you're combining that nitric oxide that you just breathed in with the carbon dioxide in your body. And then that chemical change allows the nitrogen to become your vasodilator, opening up your blood vessels. And the other part of the change is you get actual oxygen. You get about, I think it's 18% more oxygen when you breathe through your nose than when you breathe through your mouth. But since your vessels are dilating, you're actually getting more oxygen through your body into your brain. And then the rest becomes, water.
And so I know the nitric oxide opens up the blood vessels, but does it also open up the sinuses in a similar way? It opens up the capillaries in the sinuses?
Well, yeah, it all starts to open up. So people ask a lot about the neti pots. Like, doesn't the neti pot clean out my nose? And it's like, well, the neti pot works on the mucus that's in the nose, but it's not opening up the sinuses. Sinuses don't take in water. So what you need to open up is getting the air into the sinuses. And then these areas here, which on a lot of people are very flat, they start to pop open. And that's the opening of the sinuses.
Now you said, I know there's a lot of work and I've done work with you, but you said that you've gotten people's faces to change from just changing the way they breathe. Can you give like, and you have like some, there's actually evidence of this, and can you talk a little?
You can take it. Yeah. I had one patient in particular. He's about 10 or 11 years old when he came to see me, and he was wheezing and coughing and sneezing. I thought I had mold in my office. And just being in the room with him for 10 minutes, I was exhausted just listening to him. And we did breathing exercises, and I do different types of breathing exercises. I don't just do, people now, will refer to Buteyko, but I do different types of breathing exercises to help to open up their nasal airway. And in a matter of 6 weeks, doing just a little bit of myo, but mostly doing the nasal breathing, his face went from oval shaped, oblong, actually. His lips were out, his mouth was down, his tongue down. And in 6 weeks, his whole face rounded out, and he looked like this happy little kid, didn't even look like the same kid. And the whole area that changed was the sinuses and getting his mouth closed.
Wow.
So, but I see this time and time again with my patients.
I mean, people are going to hear this and think you're talking about like voodoo. Like, this doesn't even sound possible, but yeah, this is normal.
And that's when you start doing all the exercises with the myofunctional therapy, you're changing habits and you're changing your tongue posture,
I was just going to ask you about that.
which
Let's
is
let's
extremely
spend a lot
important.
of time, because the tongue is the most important part of this. And you keep saying tongue posture. Like I think of like my posture, right? Like sitting up straight.
Exactly.
So
And
what
your
is tongue
tongue has a
posture?
posture too.
Talk about the tongue posture.
So we call this one little spot um, it's our myo spot. And it's the way that I like to kind of explain it is your tongue goes onto the spot, the tip of the tongue, which is kind of like go where the ridge begins. And then the rest of the tongue is up in the palate. And so I call the spot area kind of like the pillow, and the rest of the palate is the bed.
Okay.
And the palate, it's only basically the pillow and the hard palate that the tongue rests on. And then you get to the soft palate, which is where the back of the tongue relaxes. So when you're ready to do that swallow, your tongue's already into position. You suction back and the back of your tongue comes up and does the swallow. So it's already there and waiting. And really, a swallow is unexciting. When you do a saliva swallow, nobody should see you swallow. The only thing you should see is the neck going up and down. The lips shouldn't be a part of it. So the tongue is actually doing all the work. And the tongue is basically, it's an organ made up of 17 different muscles, because it has to be able to go back, it has to be able to go forward, it has to be able to widen, it has to be able to thin, it has to be able to go up and down. And all that takes different muscles, and they all need to balance. And all your tongue muscles are down in here, in
All
your
your tongue
throat,
muscles are down there.
underneath your chin. So
Okay.
when people say I have a double chin or I have a double, triple chin, most of that is their tongue, and their tongue is down in the floor of their mouth, which rounds you out down here. When your tongue is up in your palate, you're stretching all your muscles up. So you can, tongue muscles also, again, with a lot of my patients, they come in and they have like no chin. And by the time we're done, their chin is level to the ground and they actually have a chin.
And can you just quickly demonstrate what it look? That's amazing. I'm sorry, but what is you showed the tongue in the right position and the right swallow. What do a lot of people who are doing it wrong do? How do,
So that's where one of the OMDs is a tongue thrust, or when you drink, and even when you eat and you gulp back your food. So it's like your tongue is going from here and flipping the food back, or your tongue is starting here and you're actually pushing your tongue forward. So the middle of the tongue is kind of traps the food, and then the back of the tongue goes down so that you're not getting a smooth swallow. And oftentimes, if you were to ask someone to just open and show their tongue, they'd have food all over their tongue. So meaning the tongue doesn't get into what we call a bolus, into the middle of the tongue, and then just kind of gets sucked back and down. And you have to chew. Chewing is so important. It balances all the muscles, and it's already, the saliva and the enzymes are already breaking down the food in your mouth, in your tongue. So if the food's all broken down, by the time you swallow, it's so much easier for your digestive system.
wow, so that's one of many benefits. But talk about what happens to your facial development when you have the proper tongue posture and you're, so basically, like you said, it's in the pillow, in the bed, the head's in the pillow on the bed, and every time you swallow, it's exerting certain muscles. So when you're in the right way, it's gonna give you the proper facial development. And I'll mention right now, because you could talk about this after that. Even if as a kid you didn't do this, this works as an adult, which is amazing that
Yes,
works.
you can make
But
those changes.
but talk about how
So
does the improper one, what is
So
it trying?
let
Yeah,
me
please.
let me start with your tongue is actually your natural maintainer of your facial muscles.
Wow.
So even as a kid, when your tongue should be up in your palate and it is actually forming your palate. So if your tongue isn't up in the palate, then as you swallow all and you use all your facial muscles, then those become your facial development. So if you swallow with your mouth open and your tongue is down, your cheek muscles basically are kind of pushing in on your upper arch. So you're not getting that rounded arch like you're supposed to get.
And that
And
leads
when
to
your
like,
tongue is up there,
mhm.
then your tongue is actually putting pressure into your palate and activating your palate to be rounder and not narrow, not vaulted. So that's where you get your facial development, and your tongue needs to be up into that position. So even if you were a child and your tongue was never up there, you can still change your palate with your tongue and getting
Now I
your tongue
talked to Dr.
up there.
Schiffman. He talked about like the stem cells in the sutras, which allow that to happen, allows the bones to grow, even at like what, 60, 70 years old, right?
I heard it's 73,
What's
but
that?
I heard it's around 73.
Okay.
So when someone tells you that, oh, your bones stop growing,
I've heard
or
that from
you
every
can't,
dentist. Every time I mention any of these ideas to most dentists, they tell me it's impossible because like the bone is already in place and
yeah, they say
amazing.
that the midline in your palate is already placed. You can't expand that. But even if that were true, the palate isn't just the midline. So if your tongue starts going into the sides of the palate and starts pushing and you start using it, then it's going to start making a difference. It's almost like if you were to just put your finger on someone's arm and just hold it there. After a while, when you take away your finger, you're going to have a little dent. You weren't pushing, but your finger was there for so long that your muscles and your skin said, oh, okay. And you have that mark. Well, your tongue can do the same thing.
Wow. And even like we assume that wisdom teeth, right, we're just meant to be impacted, but when you are having the proper palate, the wisdom teeth are actually supposed to just be an extra set of teeth you're supposed to have.
Well, so yes, you should. I mean, everyone should have room for their wisdom teeth. However, as far as evolution, those wisdom teeth are getting smaller and smaller because we don't need the wisdom teeth, because our arches have gotten smaller because we don't eat that tough meat, and we don't eat, a lot of the food's been refined for so many years that
But I wonder
smaller.
if myo becomes normal and people start eating harder foods again, because it has many benefits. I wonder if that won't come
Then
back.
yeah, then yeah.
I just think it's interesting that the solution is like pull out the teeth instead of looking at the facial development, which is so obvious when you talk about it, how the tongue shapes the palate. It's such a simple mechanobiology, right?
Yes, and one of the worst things is when they take out, and that's I have two thoughts going on. Sorry. So again, it's back to the breathing. So if you have a deviated septum, or if you have this really arched palate, narrow vaulted palate, that's going to push up on your septum, because the roof of your mouth is the floor of your nose. So if your tongue's not up there and you get a narrow palate, then it's affecting your airway. So along with that, then you're not chewing, you're going to start getting crowding. And that's when they say, okay, well, we can't fit all these teeth in your mouth. Let's pull out a couple of teeth, instead of widening and getting that tongue to get up.
Right. There's even like
and
palate expanders, but they don't even do that. They just, they pull the
they
teeth.
pull them, but what they're doing at the same time is they're closing your airway even more.
Oh, I know.
Because
And
they're
I know
now
people who've had that done. They
closing
all,
those spaces.
everyone I know as a kid who had that done, they all have breathing problems and narrow faces. It's so sad.
And that's
How
why
did they
sleep
get away with
apnea
that?
has become,
Oh,
because
yeah.
they're taught to do
No,
the angle class 1, and
well,
the
enough about
angle
enough conspiracy.
class 1 is the proper
Right,
bite,
right.
but they don't take into effect what the person actually looks like.
Right. No, I know. But let's actually brings us to something really fascinating that you invented. So in your journey, like, I don't think people know that you trained your mentor, Joy, was, I don't know if she was the inventor of oral myofascial therapy, but
No, that was Garliner.
But she was
way
like number
back
two
in the 70s, but she took Garliner's course.
Right. Like she was like the one who brought Mayo, I think, to out there.
Well, she got it more attention.
Exactly. So you trained with basically the best of the best, but then that wasn't enough. You went on, and just to be able to, tell me about why you decided to become a massage therapist.
So what Jason is trying to explain. And so I've taken many courses. I've taken many courses on breathing, and I've taken many courses on just myofunctional therapy. And one of the big things that people are more aware of now is the frenums, which are those little tight guitar strings under your tongue. It's in your lips. And so what I used to do with my patients, and being that I'm a hygienist and I've been a hygienist for so many years, I'm used to being in the mouth. So I would start loosening some of those frenums before frenectomy, or just to find which were tight, which were loose. After the frenectomy, the post frenectomy, to make sure that it didn't heal, and loosening up the wound sites, and making sure that the tongue could get up and stay in the palate. And then I started to really work on the TMJ imbalance, because a lot of people, when their tongue's not in the right position, then their jaw's off. So their jaw kind of follows the tongue. And that's going to cause a lot of TMJ pain. If your tongue is tied, and every time you move your tongue, your jaw goes with it, you're going to be constantly pulling on your TMJ area. And so I started doing this. At the time, I just called it an indoor massage. And I would start opening up all around the vestibule or inside the mouth. And I would also go under the tongue and loosen up the fascia underneath here and lift up the tongue, which also every single one of my patients, after I do that, will say they can breathe better, because we've just lifted it up so that you can breathe. And I go inside and open up the palates. And then I decided it was time to give it an actual name, and to be covered by all my bases, I went back to school for my massage license. And since I did that, I do what I call a clinical oral facial massage. And I work not only on the inside of the mouth, but I work on the outside of the mouth, open up the sinuses, open up the frontal sinuses. We'll do the back of the neck, which is always so tight, and work on the actual throat muscles as well to get a proper swallow. And then I work on the shoulders and the neck, the sternum, and then I do a little ear reflexology, because the lobes of your ears coincide with your mouth. So after I do everything, it just kind of brings everything together.
And people have the wrong tongue posture for decades. They come to you, you do this massage, and you have before and after pictures, right? Immediately before, an hour later of massage, and what looks different? I don't even want to say it.
Their whole face looks different. And again, while I do breathing with them while I'm doing the massage, and so where I said in the very beginning that you can see the changes just with the breathing, I'm opening up the sinuses. So this whole area will lift up, the eyes become brighter, and they're starting to breathe through their nose, and they're getting their mouth in the proper position. So you see a whole big difference all around in here. And I'm just going to kind of throw in now, there's a thing called buccal massage, which has become a big thing. And the big difference between the buccal massage and what I'm doing is mine is more of a clinical massage. I'm working on the soft tissues, and I'm working up inside. I'm not just working, to get the circulation in the skin, but everything starts changing and the skin becomes healthier. The neck, I'm doing a bit of a lymphatic massage to get rid of the toxins. And I'm opening the sinuses from the inside and then working the sinuses again from the outside. So that's where you get like some sinus drainage. And I've just had people say so many different things about how they just feel more open, and their skin tone, their whole mouth, their teeth start getting more into alignment, and their swallows are easier.
Wow. And there's many, not many, but there's a handful of people doing myo, but nobody is quite doing that. And
I don't know of anyone.
Yeah, so when they get that done,
it.
it's like you're giving them like a boost, and they still have to do the myo. That really really guides it.
Well, there's a lot of times that I'd like to do the massage first, because it loosens all the muscles and really starts getting everything aligned and relieving the tension. And once you start relieving the tension, then when you do the myo, then the myo will take away the habits that caused the problems to begin with. And then you can do the clinical orofacial massage as like a maintenance type thing to keep everything balanced and relieve the tension.
Nice. And what go ahead, sorry.
I was going to say, but it's also great for migraines. What I found though is when you actually have the migraine, that's when you feel the relief from it. But it helps with headaches. And that was one of my first, one of my patients, actually, it was her daughter that I was working myo, but she came in with a migraine. And I asked her if she wanted me to work on her. And she was like, oh, yes, please. She had it for the migraine for like 4 or 5 days, went to acupuncture, did over the counter. She tried everything. And I guess about a half an hour later, I just opened her up, and you could just see all the blood coming back to her face. I mean, she was gray, and it was like the headache, the migraine went away, and she just had, like a mild headache, and she didn't have a migraine. I spoke with her like 4 months later, and she hadn't had a migraine since.
Wow, 4 months it
So,
lasted. Wow.
well, no, and
And
she still didn't have a migraine. It was,
wow.
but that was when I spoke to her, like 4 months later, and she still hadn't had a migraine. And yeah, it just
Well, it makes
balanced.
so much sense, right? That, like that's where the tension is stored. And I've had 2 massages from you, and I can definitely say it's like an incredible experience. Like you feel completely open and breathe much better.
Oh, yeah. I mean, your lips were so stiff, or I mean, but it was also even under your tongue
Hmm.
and your swallow. Remember when we worked
Hmm.
on your throat? And so what happens a lot is the hyoid goes out of place, and it's held by all your tongue muscles. So just opening up and getting that into position makes things easier. And I don't know how you felt, but after I worked on your palate, it was like your tongue knew where to go.
Hmm.
It found its pillow and it found its bed and was
Yeah,
able
I
to
want to. We could
really
spend a
get up
lot of
there.
time talking about the pillow and the bed because it does so many things. Like like you breathe better. It actually affects your whole posture. Then there's the fascia level. Um,
And yeah,
you want to
and the
talk about any
fact
of
that
that? Are you getting
starts,
tired, or do you want to talk about? And also maybe at some point give like a little like 1 minute, 2 minute explanation of what it's like to work with you. Like how does it work? But we could touch any. We could talk about the
that's an open-ended question.
we can talk about the
Um,
fascia first, or
well,
the how the tongue
well,
affects it.
your body has fascia. Your
Mhm.
body has fascia all over the place.
And it's collagen,
And
right? It's basically collagen. You would explain it as
it's basically collagen connective tissue.
connective
And
tissue. Okay, and it's
and
everywhere.
as far as I'm concerned, it is, I call fascia really a sense organ. Fascia is a netting that is, or you could even call it like a sweater, all over your muscles. It covers all your muscles, it covers your organs, it covers the veins, and
Mhm.
it's it's all over. And when you have this sweater or netting that's all over your body, and especially underneath here with the tongue, it if there's one thing that's pulling, well, then that one pull is going to move the fascia everywhere else. So opening up the fascia up here, and if you think about it, your tongue is basically kind of centered in the middle of your body when you talk about from here to here, because the rest of your body is just a stick going down with your arms and legs. But your main body is from your diaphragm to your head, and your tongue is right in the middle, right here. And if your tongue is out of position or your teeth aren't biting properly, then that's going to put some kind of pressure on the fascia, and that's where your body starts to move out of position. And the more that that continues and continues, the more that the bones are going to follow the muscles.
So people could be having back problems. They're getting all types of massages, surgeries, and it's their tongue that's the
Yeah.
problem all along. This is
Yes.
so important, don't you think? People, doesn't it
It,
drive you crazy when you see all these things going on and you know where it's like the root of it is?
yeah. And that's basically, yeah, it's all from the root of the tongue. It's basically this area, if you think about it, this whole area, when you are anxious or upset or scared, all of the tension is held between here and here, because your shoulders will come in, you get, choked up, or you get this deep feeling in here because you're not breathing properly. And this is all connected. and the tongue actually is usually out of position. So a lot of times, and for example, when I speak about that, and my son doesn't mind me talking about it, but my son actually had social anxiety and depression, and was starting to talk in his sleep. He never had his lips closed. He was getting that forward head posture. And as a myofunctional therapist, I couldn't take it any longer. But he was over 18, so there nothing I could do. He was actually tongue-tied and lip-tied, both the lips, upper and lower lip, and his tongue. And he also had, his wings were also really tight, which is how we worked on you and opened you up there. But anyway, he finally decided, it was time to change. So I have the pictures of him when he was talking in his sleep and when he wasn't breathing properly. And then he had myo when he had braces when he was 12. Now he's like at this point, he's like 19. And so we started myo again, but we started with the breathing techniques. And in 3 months, 3 to 4 months, his face already started changing. And he loves my clinical oral facial massage. And so I did a few massages on him. And then he had his frenectomy done. So we released his tongue and just his upper and lower lip. And the change in him was just unbelievable. And he doesn't even look like the same kid. His skin cleared up. His social anxiety just went to normal, regular anxiety. And he, for a child that never got out of the house, wouldn't go look for a job because of the anxiety, he got his first job, and 3 weeks later, and then a year later, he actually went to school in Pennsylvania. And we were right across the country. We're in California at the time. And then I came out to Florida. And so he moved from Pennsylvania to Florida, but he went to the West Coast in Tampa. And he's been working and going to school. And it's like a whole new life for him.
That's amazing. And, everything is holistic and connected, but I'm just trying to understand, like, obviously getting more breathing is going to be so much better for the whole body on so many levels, right? But what else are you saying that, like, by fixing the tongue, it gave him less anxiety also, like, besides just the oxygen?
Because all the anxiety forms up here.
Mm-hmm.
When
up
you're
here.
nervous, when you're nervous,
mm-hmm.
it's attacking your lungs, it's attacking your heart, it's attacking
but you're saying that the tongue out of balance will cause you to get into the nervous state. It's like the psychosomatic type thing.
There's no studies, but I truly believe that there are a large percentage of people who are depressed and are on all this anxiety and depression medication have a tongue tie, and their tongue is never up into their palate, and they're not breathing properly. And I'm not saying that releasing a tongue is going to take everything away, but to me, I feel there's a correlation. It's part of that healthy living by having your tongue in the right position and breathing through your nose. And especially at night, which is the most important, because when you don't breathe through your mouth, when you breathe through your mouth at night, as I said before, you're not getting the proper amount of oxygen. You're not getting the vasodilators to open up your blood vessels to get the proper oxygen to the brain. And that's where a lot of kids have ADHD or ADD. And OCD.
It's even worse. It's even more than that with the sleep, because there's the NAD levels. There's so many
There's
things, the
so much.
detoxing, yeah, and it's a huge problem, the sleeping. So,
Right. If you're
and
not sleeping, you're not metabolizing.
right, right. And you're not detoxing, you're not regenerating. Yeah, it's so big. And you know, it's so interesting is that, well, the good thing is it's starting to catch on. Like there was that book I told you about, I think, Breathe, and he was
Mhm.
on like the Joe Rogan show. So, but it's so funny because people are talking about appliances and chewing harder foods, but they still haven't hit the mayo yet. Like it's like it's the most obvious, most important on of everything when it comes
Well,
to, you know, you could say like all oral health, dental health, right? Because everything is so connected to this.
well, and yeah, well, and that's where dentists should all be airway doctors. We're looking in the mouth, and ENTs are supposed to be airway doctors, but they only look at what they work on. It's hard to explain. They don't look at whether or not the tongue is in the right position and why is my patient a mouth breather? What is stopping them from breathing through their nose?
Well, again,
Um,
it's like the whole mechanobiology, like the whole philosophy of medicine for so long has been looking at things a certain way, but in fact, it's like the massage therapists who actually know the body better because it's not what like the body is not what appears in the textbooks, right? You need to see how it's all connected, and it's
exactly. It's what is the root cause?
yeah.
And that's what we need to base it on. And it's just a simple tongue placement at which and checking the frenums. And do you know that when they do every hospital, and this is around the whole world because they all go by this certain protocol when they check someone at the hospital, and they may check every little part, but nobody checks the tongue.
Oh my God.
Nobody checks tongue position, and if they're breathing, if their nose is clear on both sides. So a lot of times, everyone, as far as a deviated septum, oh, well, they can breathe out of one side. It's like, yeah, but what happens when that side naturally closes? They can't breathe. And
Wow.
that happens like every 20 minutes. And then you have your
We got
mouth
to get the
breather.
word out, that's for sure. And I'll just say, from working with you now for a year, it's like what you're so good at doing is looking at the person just in 5 minutes, you're just picking up on their habits, and then you work at the root, at the most important thing, you clear it away. Then you look at what's next. Okay, we got rid of the root cause. Let's get rid of, we got rid of the roots. Now we got to go to the branches, and little by little, you chisel away at the whole problem because it's all there's so many pieces.
Well, it's basically
But it's simple, but it's
awareness.
mhm.
Yeah, it starts out with awareness and breathing, and then you get to your toning and stretching, and then you get to your getting rid of old habits, starting the new habits. I like to call it conditioning those habits to get all those new habits into permanence. And then once you're in permanence, everything should start to flow.
And that's really like how everything should be taught, and that's how we really learn things. And first, that's why in the beginning it's hard because you're going against an old habit, and it feels like a lot of work. But a good teacher, a good program will get you to make it so after a while it becomes the habit, and then you don't have to think about it anymore. It's just the right way to do it, and then the results happen even quicker and quicker with less effort. It's incredible.
Exactly. And when I show someone, even in the very beginning of therapy, and we went over this, um, the proper saliva swallow. And when they get it, it's like did you notice you didn't use any muscle but your tongue? How relaxed it was? And I was
Well,
like,
one
wow,
thing I bugged out about was like how my jaw was connected to my tongue or my lips with speaking. I was compensating for my tongue using my lips all the
you
time.
you constantly had your lips forward to do everything. And now that you've had the release of the lips, so now we're finishing up that toning process, but your lips were always forward, which affected your speech, which affected your tongue. And your tongue also never, the back of your tongue never, middle of your tongue really never got up
And
there.
because of
So
that, the range of my speech and going from certain letters to different words took more time. So I compensated by just not pronouncing things properly in order to keep up with my flow of thoughts.
yes, and your flow of thoughts keep running. So your
Yeah,
tongue actually
it's still too
literally has
fast.
to do this.
Yeah.
And it just couldn't, it didn't know how to. And now it's starting to get more into position and starting to move more, but it's also your tongue's not looking for your lips anymore. And your lips are actually starting to go back and you've got a wider smile. And just your whole face has like widened out.
Well,
Squared out.
didn't we measure? You measured me, right? Like that was crazy. What did you notice? The
The
top,
symmetry.
the top, middle, and bottom also, right? Like the middle of my
Well,
face
yes,
grew in comparison to the.
to the bottom. And you had like a really kind of, was it a short bottom, but you also had these two were just so off. But when you got the breathing and this area opened up, so now this area and this area are now more even. And because you would hold everything forward, this whole area kind of went down more. So you were longer down here than you were here. And so now all of that has changed.
Well, awesome.
You're
Why
looking
don't we?
good.
Thank you. Well, it's been incredible. It's been a year, right? And we just did the frenectomies, which maybe we'll save that
Yeah,
for next time.
for another time.
Yeah,
But
there's
yeah,
a lot more to talk about, but thank you so much. I'm just